We have all seen in the headlines news about the opioid epidemic. We intuitively know that its impact is devastating, but do we really know what it is or how to solve it? In this video, we will explain what the problem is and show you a simple way to make a big, positive impact. Let's start by taking a look at what happens when people get hurt and they go to their primary care physician or emergency room for help. Many of them will heal, the pain will diminish, and they will be on their way. But others have chronic pain and will need continual pain management. When used properly, opioids can be an effective pain management tool. Among those who need pain management, there are two groups of people. The first group are those who are compliant. In other words, they take their medication as prescribed by their medical care professional. They are doing what they're supposed to do. The second group are those who are not compliant. They do not take their medication as prescribed. Multiple studies show that as much as a whopping 69% of those who are receiving opioid prescriptions are not compliant. These patients are not getting better because they have chosen a path that will not help in their recovery. Is it really that big of a problem? Yes, it is. Some of them have become addicted and are taking the opioids because they like how it makes them feel. Others are not taking their medication and are instead selling them on the black market. They have found that they can sell Percocet, oxycodone, morphine, and other prescription-based painkillers, and use the money to pay their rent and or buy illicit drugs like heroin. In fact, according to the DEA, the #1 source of money that is fueling the black market for illicit drugs comes from non-compliant patients who are receiving opioid prescriptions from their doctor and selling them on the street. In addition, studies have shown that over half of those in treatment programs are self-medicating. Patients are buying and taking 5 to 10 times the recommended dose of opioids a day. Our laboratory testing has shown that only 31% of those who receive opioid prescriptions are compliant. Ironically, many of the people involved in the opioid epidemic are normally law-abiding people who got injured, experienced chronic pain, and ended up requiring pain management. They got addicted along the way and ended up in the group of non-compliant patients. That is the opioid epidemic in a nutshell. So, what is the solution? Simply put, test every patient every month, including those you think are compliant for not only illicit drugs, but for prescribed medication usage. If you are prescribing 150 milligrams a day of an opioid painkiller and the patient is taking the medicine as prescribed, that will show up on their toxicology test and you will be able to monitor the patient over time. The toxicology reports you include from Beechtree include a trend chart allowing you to see at a glance the patient is following your treatment plan over multiple testing dates, up to 25 on the front page. This makes it easier for you to adjust the plan based on empirical evidence and scientific data points. On the other hand, if you're prescribing 150 milligrams a day to a patient who is non-compliant, their testing report will show you immediately what is happening. You will know that the prescription is not in their system, and you will know that they are not compliant. At the same time, you will be able to see if there are other medications and or illicit drugs in their system. The only way to stop the opioid epidemic is to know what is going on with every patient by managing these patients with monthly toxicology tests. This one step will do more to stop the epidemic than any other action. Positive clinical outcomes are made possible with medication management. The results you need to effectively use in your treatment are available from Beechtree Diagnostics. If you would like to learn how Beechtree can help your staff to more effectively help your patients overcome opioid addiction, we invite you to schedule an appointment with one of our representatives.